we want to acknowledge that the webinar is occurring while Puerto Rico is still dealing with Hurricane Fiona, and Florida is preparing for Hurricane Ian.
Thank you for that note, April.
You're welcome.
Now, in observance of National Preparedness Month, which is this month of September, we wanted to raise awareness about the importance of inclusive planning for disasters and emergencies. Today, our panelists will each speak about disaster planning in their area of expertise. They have 15 minutes to present, and all questions, will be taken at the end of the presentation. Please put your questions into the chat box, as I will be moderating that, and please preface the question with the name of the presenter you would like the question directed to. So let's cover the objectives that by the end of this webinar, participants, you, the audience, will be able to recognize the importance of community participation in disaster planning and preparation, evaluate current disaster plans to determine if they are inclusive and serve people with disabilities, and also identify how an organization's disaster plan can be more inclusive. Today, we would like to welcome a fantastic trio of presenters, Sandy Hannahbrink, Dr. Beatrice Quinones Vallejo, and Dan Wilson. I will introduce each of our panelists, starting with Sandy. And Sandy Hannebrink is the Executive Director of Touch the Future, Inc. She is a disability advocate and disabled occupational therapist with a practice niche in disability rights law, accessibility, assistive technology, inclusive disaster strategies, and connecting individuals with disabilities to service providers and necessary resources to meet individual and organizational goals. Sandy is an active member of the Partnership for Inclusive Disaster Strategies and currently serves on the United Nations G3 ICT, if I said that correctly, Neuroabilities Advisory Committee. Next is Dr. Beatrice Quinones Vallejo. She is the president of Health Communications Institute, and for nearly 2 decades, she has worked in emergency preparedness, response, and recovery. She served as the Disability and Preparedness Specialist for Puerto Rico with the Association of States and Territorial Health Officials. And since 2009, she has led different organizations during multiple public health emergencies that have occurred in Puerto Rico. And she will be speaking today from Puerto Rico. However, community outreach is her favorite work, and she is a professor, enjoys writing children's books about emergencies and inclusiveness, and loves living and working in her tropical island. And finally, Mr. Dan Wilson, who is the Deputy Director at the University of Virginia Claude Moore Health Sciences Library. Locally, he is the library's representative on the UVA Health Emergency Preparedness Working Group and has worked with the Charlottesville Albemarle Community Emergency Response Team, CERT, and the Blue Ridge Medical Reserve Corps, MRC. Nationally, for many years, Dan has worked with the network of the National Library of Medicine on emergency preparedness activities. He looks forward to being a panelist because he understands the importance of inclusiveness in disaster planning from his work with public libraries. And I asked Dan to include this. A fun fact about him is he grew up in northeastern Pennsylvania, Bloomsburg, and he still has a great affinity for tea-berry ice cream and Middle Swarth potato chips. So that is the presentation of our panelists, and we will move on to welcoming Sandy Hannahbrink. Sandy, take it over.
Thanks, everyone. I'm excited to be here. such a critical thing to understand. So today I'm going to talk about more the role of the advocate and advocacy with looking at things the way I've been involved in and seen success. So one is, how can one single person make a difference in a huge way? And that's working in your local community first, with your own resources and contacts, and working with your local governments and disability service organizations and disability-led organizations to bring people together to have a conversation. One of the ways I got involved early was just looking at, in my own city and county, where do they typically use shelters, whether it's for power outages, freezes, or flooding, or fires, or the type disasters that tend to hit our local communities. And then, are those accessible from the beginning on just physical access? And then we start looking at, how are they providing communication access, and how are they providing other supports and resources for people with disabilities and seniors. And so that was kind of how the focus was in the local community, and making sure that when they use a church or a gym or a community center, that those indeed from the beginning are accessible, and not, oh, we'll make it accessible if we need to after the fact in the midst of a disaster. The other then is to move from your right outside your door in your local community, is to mobilize, like what we've done in South Carolina with the disability community, and working with the Centers for Independent Living and other disability-led organizations, and the service providers within the state, Red Cross being a community organization, but with the state organization and the individuals who serve on the state disaster management, is to have that disability voice present, and then meet monthly, year round, and then leading up to imminent disasters like today, trying to prepare for Ian to hit what's going to happen in South Carolina, with winds and storms and flooding projected, with a potential turn as it comes across Florida to up the South Carolina coast. We've been looking at what areas are impacted, where are our low-lying areas, do we have things in place, what shelters are they looking at mobilizing first, what level of shelter, and that, but working with the different organizations. So we have like the Department of Health in South Carolina, we've got emergency management, we've got the Department of Disability and Special Needs, Voc Rehab, Department of Justice representation, so state, federal, and then local disability organizations meeting in what we call in disaster land blue sky, when there aren't storms, to plan, and then making sure we have equipment in place, and making sure that as disaster gets closer, what shelters are they projecting that will need to open first, and then do what is set up for protocol. Is it just going to be an empty building that gives people some place to go, or is it going to be elevated to where there's going to be, it's manned with food and cots and things like that? What's going to be there, so that we can help get the word out to the disability community. The other is efforts that we do is working directly with the disability community and planning, so that people have their own emergency evacuation plan, that they know what supplies they need, that they have all their papers and doctor's numbers and medications and extra supplies and prescriptions from their physicians, that in case they have to evacuate in a hurry and they don't have enough supplies, that they can get it to wherever they land. Where are they planning to go? Are they just going to wait and see if there's a need for a shelter and go to a shelter? Or are they planning to go to family or friends outside of the danger zone, and do they have transportation for that? So those are some of the things that we work on in order to do that, and actually put some kits together so that if there is an evacuation, there's some supplies that people with disabilities may need to get the shelter started until they can get other things mobilized and brought in. I think the other part of advocacy that's important is understanding how disaster declarations work. Because if the county doesn't get approval from the state to declare an emergency, it's all on the county, right? If the state doesn't do a declaration of emergency, then it doesn't trigger to federal for FEMA and assistance and things like that. So understanding that. It's also important to understand that even though you have good intentions and want to advocate and help, unless you've been through the proper trainings, unless you've got the proper certifications, trying to help in the middle of a disaster when you don't know how to do what needs to be done actually gets in the way. And then, and you won't be allowed in, because only people who are allowed in can get in during a disaster and after, right? And so knowing those kind of things is important. The other is how to get the word out so that the disability community knows who to contact if they need help. One of the ways we've done that is through, at national level advocacy, like we do at a state level. Disability-led organizations work in coordination with the Partnership for Inclusive Disaster Strategies and meet monthly and weekly and now daily since the hurricanes and fires and all the different disasters that we face across the country have been happening. And then specifically also meeting in addition to that with COVID response and concerns, because now that's all complicated how we do things. So we meet on Tuesdays, again, with federal agencies, Red Cross National, and disability-led organizations and disability advocates from across the country to meet about what's happening, to help push legislation, to help clarify discrepancies, like when CMS puts out a letter that's a waiver that would be in violation of ADA or would be a violation of FEMA requirements, because, you know, we all know agencies work in silos, and one thing can impact another. So, so that's kind of where we are with that. So one of the biggest things that we've done with the partnership is centralize, instead of having a different hotline for every state and community, we have one disability disaster hotline that works for globally. I mean, we even used it with a WhatsApp number, and that for when Bahamas got hit. So anywhere in the U.S. territories, and then we've also supported Bahamas and other areas, so that people with disabilities can call a toll-free line or send an email to alert us to a need, and then we actually can get boots on the ground to go in and help. And then after a disaster, when it's time to start with the recovery efforts, we're able to actually mobilize the disability community to go in with the specific target of supporting people with disabilities who, as we know, when state systems are trying to help the masses, they worry about disability last. And a lot of the people with disabilities get stranded and stuck because there's no way for them to get out. They didn't have transportation and ways to get out of their homes before. And so certainly during the disasters, that makes it even more complicated. And so then we work on meeting those specific needs, boots on the ground after disasters. And all that comes through a coordinated network, again, working through federal agencies to state agencies, working with Federal Red Cross to get in contact with regional and state and local Red Cross services, with working with disability-led organizations at a national level to filter down to the local Centers for Independent Living and other disability-led in order to meet needs. For example, in South Carolina, during one of the hurricanes, we had people out on the barrier islands outside of Charleston for a gentleman that was with receiving hospice care. And so they had because he was getting community-based services, he should have been able to go to the local shelter, but the local shelter said, we can't support him. And the hospice agency had evacuated all their staff. And so then we had to work together with getting the state agency that oversees the hospice programs, and also happens to be the same agency that oversees the medical needs shelters, to help coordinate and to advocate to help us track down residential hospice that we could relocate the gentleman and his wife to, and then figure out the transportation through a network of volunteers and stuff in order to help get them out. Same thing like we did in Louisiana with the Cajun Navy, and helping them to partner with that where they were going in, but giving them training so that they could go in and help people with disabilities get out, so that people wouldn't be left to drown in their homes because they had no way out. So that's some of the efforts that we do.
Sandy, I don't want to interrupt you. I just want to tell you, you got about 3 minutes left. It's
I'm
awesome.
good.
Thank
And
you.
so the biggest thing is that I want to share, and I only did the one slide, is so that you guys have the disability and disaster hotline that you can post and share. It is active 24/7, 365 days a year. And it is manned by disability-led organizations and individuals who specialize in supporting people with disabilities during disasters. So just wanted to thank everybody for the opportunity, and I look forward to the end to any questions you might have.
Well, thank you so much, Sandy, for your unique perspective. I'm so excited to have you three. As I said earlier, there are a couple, I wanted to bring everyone's attention to the chat. There are a couple of links that have been thrown in. And next, we're turning it over to Dr. Beatrice. And you're up next. How are you feeling? Okay? You ready?
Yes.
Great.
Thank you for
Welcome.
having me here. So it's a pleasure to be today with you. So first, I'm going to start with some background around Puerto Rico. Puerto Rico is an island that is part of the, next please, it's a territory of the United States. We have 78 municipalities, and all the municipalities are very different, and the population is very different. After Hurricane Maria, a lot of people left from the island to live in the mainland. So now we have approximately 3.2 million of people. Our leading causes of disability and death are heart disease, stroke, cancer, diabetes, asthma, and Alzheimer, and 21% of our population live with disabilities. We have 44,000 people that depends on technology and needs medical devices, and also 200,000 people are part of the deaf community, and you can see how important it's the sense of hearing to understand emergencies. So next, please. For the last 13 years, we experienced, I cannot remember how many emergencies. We had outbreaks, we had hurricanes, Hurricane Irma, Hurricane Maria, we had earthquakes, and now if you can see the cycle of emergency management, we are responding to a hurricane that we had 8 days ago and devastated our island, but we are still working in recovery and mitigation from Hurricane Maria and from the earthquakes that happened in the south of the island. Next, please. So, but having this emergencies, for example, from Hurricane Maria, we had so many lessons to learn. almost 5,000 people died after Hurricane Maria just because things related to health issues, lack of access to health services, lack of access to health information, lack of access of power to connect their medical devices. So that brought us a new visibility that we need to plan with, and we need to be inclusive in our planning, and we need to plan for people living with disabilities. And now I'm going to share with you some of the efforts and next please, and the best practice that I experienced firsthand with some of the communities. I'm sure that there are so many of these efforts, but I'm going to share the one that I know very well. So one, Sandy was talking about advocacy, and one of the things that it was wonderful for me that I can experience now is that there is this organization that it's a movement for independent living. After Hurricane Maria, they said, hey, we need to stop doing what we were doing. We need to, let's bring every organization that is working with people living with disability to the table, and let's start working together, and let's prepare, let's do advocacy together. And they develop what now we call the CACs, and the CACs are the Core Advisory Group. So they share all the experiences that they had during Hurricane Maria, and now today they have a seat in the Emergency Operations Center. So they are working back to back in a daily basis with all the governmental organizations to address all the needs that they receive from people living with disabilities. So that it's a good practice. As far as I know, that never happened before in Puerto Rico, and that it's something that we have to plan for. So that it's a good lesson learned that I want to, a good practice that I want to share with you. Another lesson learned, it was a technical assistance that, next please, that we have from the Association of States and Territorial Health Officials, which we call ASTO. They brought a disability and preparedness specialist to the Puerto Rico Department of Health, specifically with the Secretariat of Family Health, Integrated Services, and Health Promotion. In this secretariat now, all the programs related to chronic diseases and programs that provide services to people living with disabilities, they work together in this secretariat. So what they want to do is see how they can improve the way the teams at this secretariat improve the way they work with people with disabilities during emergencies. So what we did is that we sat in the table. These people were responding for the last 5 years to different emergencies, so they were burned out. And we decided to have meetings with them to see which is the knowledge that they have about how to handle public health emergencies, which are the organizations that they were partnership with, and the information they have about emergency operations plans or communications plans, which were the materials, the educational materials that they were using and were available, and which were the experience that they have. So when we gather all this information, what happened was that we understood that they were burned out just because the lack of things, a lack of information, how to handle emergencies, a lack of information that there are emergency plans that they need to follow, a lack of knowledge about the chain of command, a lack of knowledge about resources and data that they can use to plan with. And what we decided at the end, it was to make a work plan. And next, please. This work plan includes let's go to basics. Let's do a public health emergency preparedness academy, and let's start with emergency 101. Let's see how this is supposed to be working. And this is what you need to do. Let's sit everybody on the table. Let's see which are your resources. Let's see which is the data that you have, because you need to use your data for planning and you need to be inclusive. Which are the organizations that are providing services that can help you? Do you know that there is a healthcare coalition that can help you too? Do you know that there are some leaders that can help delivering the message and address the needs of the people in the communities? So we went back to basics. Then, after having 7 months of this academy, we decided to develop what we call the Puerto Rico Department of Health Access and Functional Needs Committee that is just working right now. It's a multi-agency committee that can help gather the information of all the organizations and work with a chain of command to address the needs of the people. We gather all the educational materials and we send it to the organizations that provide services to people living with disabilities so they can give us the feedback about what is needed in terms of education. So they help us with that in compliance with the ADA law that Sandy was referring to. And we start establishing partnerships to help them to improve the way we plan and respond. And at the end, with all this information, we develop emergency plans that includes a lot of different angles that were not included before. Next, please. So other effort that we have been working with, it's having workshops and conference, talking about maybe what we can call difficult conversations that most of the people they don't have to talk about. And you know that most of the people that that live with disabilities, they are more vulnerable to violence, physical violence, verbal violence, and also sexual violence. So we start having these workshops not only with first responders, but also with shelter administrators to understand that this is a reality, that we not only need to plan for the fridge for the meds, we need to plan to see how we can handle this kind of violence and how we can make referrals and how we avoid this kind of things. Next, please. So another thing that our efforts are little steps, because we have a lot of different things to improve, but something that we are working with, it's that even though we are supposed to have a big registry, and I know that there are so many opinions about registries, because sometimes people depend on the registry and sometimes they don't move, they're not active because they think that if they sign into a registry, the only thing that they need to do is wait for somebody to come and get them. But the beautiful thing about the registries in the municipalities is that some mayors, they brought to this effort the community leaders. So they can help to make the registries in their communities to see where are people with disabilities located and which are the needs that they have. So they can help understanding the needs, understanding where they are locating. So it's supposed to improve our response. And the beautiful thing about this is that community leaders are involved and are empowered about their communities, not only in the planning phase, also in the response phase that we're experiencing now. And another thing that I want to point about how we improve the response, it's bringing other stakeholders to the table. For example, during COVID response, we have the National Guard working with us during the vaccination for bedridden people. Next, please. So as I told you last Monday, we experienced Hurricane Fiona. And one of the things that we are working since Hurricane Maria, it's communicating with deaf community, with interpreters. In Puerto Rico, not everybody knows the sign language, but some of the deaf community, they know it. And now, even though it's a law, we had to be in compliance with that. Now, every message from the government has an interpreter for this community. Again, we have an island-wide blackout, and we suffered just exactly some of the things that we experienced during Hurricane Maria. And even though there is still there, we did, next please, we did a lot of efforts, and we have a page that is only related to on how to handle preparedness and response. We still have to look for help to evacuate bedridden people. And unfortunately, even though we have the Empowered program data, we didn't use it to localize these people. So there's still a lot of work to do. But there are some things that I want to point out that we will never forget. Next, please. And it's important.
I'm sorry, I don't mean to interrupt you. I just wanted to give you a 3-minute surprise mark. So
Okay,
thanks, keep on going.
Okay, so what things, even though I talk about data, it's very important to build capacity in first responders, because sometimes when we are involved in working with the people living with disabilities, we take it for granted that everybody knows about the needs that they have, and it's not like one size fits all. No, we need to improve the way we educate the first responders and also the caregivers. And Sandy, we're talking about that. And when you provide the caregivers information on which are the services that are going to be provided, what are going to be the services, and you're going to have an active people that it's going to respond to an emergency in a better way. But also, we need to educate media about which are the needs. And the important thing about this is that they help us to expand the knowledge, but also, Stanley, we're talking about advocacy, and they can help us. If we talk to them about the do's and the don'ts, they can help us delivering the message and help us saying, well, these people, they are not, that we are not helping them, we are not including them in our planning or in our response. And part of this is that we need to stop the myth. We sometimes people feel that people living with disabilities, they don't want to get part of things, that they don't need help, that they don't want to get help. No, we need to stop working. We need to say, hey, this is not real. These are the needs that they have, and we need to be inclusive. And last but not least, even though we are planning, planning is a process. So even though we want things perfect, that's never going to happen. We need to be flexible, and we need to be active listener to understand which are the needs that we need to address at a certain point. And that's the only way that we can plan with, not for. We need to be inclusive in planning. And we as planner, we need to be facilitators, and we need to make connections. We need to make networks, and we need to be inclusive not only in planning, which is the conversation that we are having now. We need to be inclusive in advocacy and preparedness, but we cannot forget this in response. In response, we are sometimes in a rush, that sometimes we forget this, and obviously in recovery. So thanks very much.
Dr. Beatrice, thank you. I know April's going to come in and welcome our next guest, but I wanted to just bring your attention back to the chat. We've had some great resources thrown in, resources to locate used durable medical equipment, and also some questions. Remember, throw in your questions, and we will direct them to the presenters after our in our question phase. And I'm really excited about this third panelist. So I'll let you introduce April.
Oh, okay. Well, Dan Wilson, bring the library perspective. Thanks, Dan.
Thanks, April. Thanks, Sarah. And hi, everybody. It's such a pleasure to be part of this important webinar. What my focus is going to be is on your disaster plan and how it can reflect your sensitivity and awareness of the needs of disabled persons and how to operationalize it. And the title of my presentation is Baking Awareness of Disabilities into the Planning Process. And I'll start by talking about who the chefs are and conclude by talking about the recipes, which is the one-page disaster plan. So the chefs are the emergency planners and the disability advocates. And as Sandy said, it's important to start these conversations during blue skies and not to wait for some kind of disasters. You can always learn from disasters, but it's best to start the conversations during the blue skies when there isn't a disaster in the works or anything, and when everybody has time to plan. And then also, as Sandy said, it's important to hold regular meetings with these people as well. You know, it's not just a one meeting and so forth. You want to hold regular meetings. And they are essential components to any disaster planning initiative. Remember, these people are free resources to you and will definitely raise the level of your disaster planning effectiveness. Pictured on this slide is a disaster planner from Delaware who spoke at a pre-pandemic disaster planning conference that was sponsored by NNLM in Dover, Delaware. It was a conference that was designed to promote partnerships between emergency planners and librarians. And both speakers before me talked about the importance of getting people together and to either design and create a conference or just invite them to your meetings, invite them to your conferences, whatever, and invite them, share information with them, learn from them, and they will learn from you as well. Emergency planners can help you assess your risk. They can help you develop your plan. They can organize safety planning for you. And they can also conduct a tabletop exercise. And tabletop exercise is an opportunity to exercise your plan and also to make sure that it's up to date at a time when, again, there isn't a disaster going on. And also an important step here is when you reach out to your disaster planners, remember, leverage your space. You know, libraries have space. If you work at a library, you have space. As emergency planners are often looking for space to conduct meetings and exercises. And your space could also be used in disaster response. So, you know, you would have these emergency planners regularly coming to your space to use meetings and exercises as well. So again, it gives you an opportunity to keep that contact with these planners. And as you heard from both Sandy and Beatrice, disability advocates can help identify specific needs of disabled persons and can help with emergency preparedness and response. So you have your emergency planners and you have your disability advocates. Next slide, please. Towns and municipalities have an emergency planner, and emergency management can help you also with vulnerable populations. This is a page from emergency management in Roanoke, Virginia, and it's too small for you to read, so I'll just read it to you. There's a paragraph in here that says, prepare today, register yourself, your family, and your business. If you have any special need or considerations that community responders should know prior to a disaster or emergency, follow the instructions under the Emergency Needs Registry link to let us know if you have any communication limitations, critical medical needs, or your business is at high risk or houses vulnerable populations. Make sure every family member or employee registers their phone with our reverse 911 center. This service allows our dispatch center to reverse call landline and register cell phones to receive critical information during disasters and emergencies, including information on evacuation. You know, so Sandy and Beatrice are working behind the scenes and working with these different emergency planners and making their response better, I'm sure, as well. And it's reflected on this page. Next slide, please. So while you're reaching out to your emergency planners and disability advocates, begin developing your one-page disaster plan. And this is a one-page plan where in this metaphor, it's a recipe. So everything that you're learning from the different areas, the planners, the advocates, they can go into your recipe or your one-page plan. And if your library doesn't have a one-page plan, I really highly recommend that you look into this, and I'll be providing a link to a Word template of this plan. So all you will need to do is download the Word document and just kind of plug in your information. But on the slide now is the front page of the one-page plan. And I'd like to highlight a couple of these columns. The first column details the duties of the emergency response coordinator. And as you can see, it's kind of written in a checklist kind of way. And so each library, we're recommending appoint an emergency response coordinator who has interest in this area and can carry out these types of responsibilities. Now, concerning inclusiveness and disabilities, if you look at the bottom of that first column, you'll see a couple of areas. For example, conduct an after-action review. An after-action review is basically a non-judgmental review of a disaster activation. And so you get different people together. You get those that perform the activation, as well as other people like emergency planners, to assess and to judge the way that you responded to the disaster. And this is a necessary part of any type of plan. And it's a safe way. Nobody gets blamed for anything. But you learn what went well and what didn't go so well. And my recommendation is you bring in a disability specialists into this review process as well. For example, we had a situation here in the library where we had a person who was kind of bringing in a lot of their belongings, and the service desk staff approached them, didn't get a good response. So we called security, same thing, didn't get a lot of a good response. And so when we had our after action review, our DEI specialist said, well, why don't you bring in a social worker in this type of situation? So I contacted the security team, and we talked about, and now we have a different procedure for handling this type of situation. So again, after action review is very important, and bring in as many people as possible, and especially an accessibility or a DEI specialist. Also on this in this column under preparedness responsibilities, there could be a bulleted item about an annual review of the plan focusing on persons with disabilities, as well as focused attention on disabilities during any tabletop exercise. Under the communication plan, the third column over, please be sure that you're communicating in a way that reaches persons with disabilities. And again, you have disability advocates that are out there that would love for you to contact them and go over your communication plan and how you can make it better. Next slide, please. So this slide is the backside of the one-page plan. And I'd like to emphasize the first column on the left, which is your list of response procedures. And I'd like you to note that the procedures are written succinctly to promote memorization. So if you have this type of one-page plan, you can have these succinct type of emergency response procedures that are vetted by emergency planners and first responders that can help you when there is some type of disaster. So instead of trying to look up to see, oh, what do I need to do if there's a tornado warning or a power outage or something like that, it's already been discussed. It's easily accessible to everybody. And so when you're looking at these, look at them through the lens of a disabled person. For example, how would a hearing impaired person receive information that there was a tornado warning? Or how would you get a person in a wheelchair out of a building in the event of an earthquake, fire, or power outage? So these types of emergency response procedures that are on that one-page plan can help you and can make your plan and your response more sensitive to the needs of disabled persons. Over on the right of this page too is another column that you might want to look at as well, and that column deals with, and if you scroll down at the bottom, you can see on the column before that, it talks about if the library is relocated, and we all know that there's a big hurricane, Ian, heading towards Florida, and there might be libraries that are impacted by this and have to relocate into other areas. So not only are you thinking about your patrons, but you're also thinking about your staff as well. What needs do your staff bring to a change in location for the library? So throughout this one-page plan, I think, and you may find others as well, that you will be able to make this plan more sensitive to the needs of disabled persons. And next slide, please. So just in conclusion, just to talk about some of these takeaways. First of all, and you've heard this over and over again, reach out to emergency planners and organizations that serve disabled persons to help you formulate your disaster plan. Start tomorrow, start this afternoon, whatever, but start to reach out. Leverage that space. That space that you have is very valuable. A lot of nonprofits are downsizing following the pandemic. You know, there's more remote work that's going on. So they're downsizing their brick and mortar location. They're losing that big room that they used to do planning and exercises. You can offer that space. Download and fill out a one-page disaster plan, which will be on the next slide. Add disability awareness action steps into your local library's emergency response coordinator role. That's on that one-page plan. Include an IDEA, inclusion, diversity, equity, accessibility person in your after-action review process. Partner with local emergency planners and advocates to assist with preparedness. Contact local emergency planners to ensure that your emergency response messaging conforms with the needs of persons with disability. And finally, again, work with local emergency responders to make sure emergency response is sensitive to persons with disabilities. This is the message you've heard over and over again, and it's a very important message. And the last slide, please. So last slide is my contact information. Feel free to reach out to me at any time. I can help you with the one-page plan, formulating it. I can help you connect I've worked with public libraries, I've worked with state libraries, so I can help develop some type of partnership strategy for your library or your groups of libraries. And then finally down at the bottom there, it says the template for the one-page plan. If you go to that page, at the bottom of that page is a Word template. You can download it and you can just take out the names I have in there, put new names in, put in your response plan, and start working with your disability advocates, emergency planners, and your library will be in better shape in terms of handling the needs of the disabled. And that's all for me.
Well, thank you, thank you. A big, big, big thank you to each one of our presenters today. This is the Q&A portion. Are there questions? And I'm going into the chat to field some. I know that the first one was to Dr. Beatrice, but I really think this is an interesting one, probably for everyone. It's good to see that so much work is being done to help everyone in PR, Puerto Rico during disasters. Have you noticed a difference in administrations in Washington, D.C. with regards to assistance or help in Puerto Rico during disasters? And have things gotten better? It's probably a pretty touchy subject, but I think that even Sandy might have a perspective on that with her connection on the federal level. So anyone to that?
Sure, I'll answer. On a federal level, there's now an interagency committee on disasters that didn't exist. And a friend and colleague of mine actually serves on that committee, and that's to try to eliminate the silos and make sure that all the agencies are acting in the same way, and to try to streamline things better and have better communication across agencies, and for that to trickle down. It's been slow going because it's just rolled out, but it's certainly a start, and it's not just a committee in name only. They actually have a budget. So that's where I can say under this administration, at least, they've at least put some money towards accessibility and inclusion. They've done monthly, sometimes weekly updates on initiatives specific for the disability community, straight from the White House staff as well. So I've seen some changes there. Now, I'd be interested to see what Beatrice says, how they're feeling the effects at the grassroots level there. We haven't had, in the 3 states that I do most of my support through my organization with, we've been fortunate not to have a disaster since this has been rolling out yet, except for the one that's coming now. I guess we'll find out.
Thank you, Sandy. So I just want to add that you can see the difference. The declaration of emergency was approved very quickly. And the other thing that I want to add about this, it's in inclusion when we are planning, when we are responding. Another thing that it's very, very, very important to take in consideration is the cultural competence. We will never forget in Puerto Rico the situation that we had related to toilet papers. When we were responding to Maria. So there is something very delicate that we have to take in consideration, the cultural competence. How do you refer to the people that you are trying to help that are part of the population that you are supposed to be taking care of? So it's cultural competence is something that we will never forget to take in consideration every time that we are working in preparedness and in response.
Great, thank you. Let's see, Dr. Vallejo. We have seen much in the media with the work that David Bugno has done supporting getting the word out of the major needs of Puerto Rico following Hurricane Maria. Can you share with us your perspective how clear messaging and open channels has helped the island continue to recover when champions like David take action?
Oh yes, actually he's let's say he's a friend. He's a friend. I think that he feels Puerto Rican. He's the friend of our island, and he helped us very much with the visibility of the situations that we were experiencing. He's still doing that. But something when I said that we need to talk to the media and we need to educate media is that data, it's very important to form opinions too. So it's like when you are doing health education strategy in case you want to make people, you want people to make decisions well informed about their health. It's just exactly the same. So we need to provide data and correct data to media so they can help us in a better way. So that's important from our point of view to take in consideration that when we are planning, when we are working in response, we are very emotional, but we need data to send out information so that it's coming back with the best effort in the response phase.
Dr. Beatrice, thank you so much. I wanted to also compliment you on your data-driven notation. The audience here appreciates data and data-driven decisions. So thank you. Here's a question for all speakers. So Dan, I'm going to let you in, drag you in for us. So someone wrote, so many speakers have spoken about the importance of regular advance work to build community and capacity and relationships for disaster response prior to disasters occurring. How do you build willingness and engagement for these processes? And also, how do you build the willingness and engagement in both library administrators and community? And this is probably that age-old question. But Dan, what do you think?
Okay, well, that's a very good question. And willingness and passion. I'll add passion. I think you need to find passion somewhere. And it's the type of thing, if you're looking at a library, and if you just kind of give this to somebody, you're not going to have the results, the engagement, the willingness as if you would if you find somebody that's passionate about it. So I'd like to start by talking about the person in your library that's kind of assigned these roles, the emergency response coordinator. If you can find somebody that's passionate about that, then you're off to a great start, because there's passion and there's willingness, and I think you've heard that from the speakers as well, within the community. And so it's just making those connections with the community. And once you start making connections, and whether it's through your local emergency planning department or some other access, you'll start to, at least from my experience, you will build on that, because there's a lot of energy. There's a lot of again, I'll come back to passion to make this a better place. And the preparedness, the response, those two areas, there's a lot of action in those areas, but make those connections, and you have to make sure that those connections are made by somebody that's very passionate about it. And if you have a library administration that's not so passionate about it, you're going to have more of a challenge. And so I wouldn't say that you stop right there, but you try to build the willingness, you try to build the passion first within the library, and then make your connections. And once you make those connections, I think the library administrators will see how valuable that is to your patrons as well as the library.
Yeah, and to build on what Dana said there, the passion also comes from telling the stories. You're not doing it for people with disabilities. You're doing it with people with disabilities. And, you know, at a local level, it means, you know, going with family and friends and people in the disability community and have them show up at council meetings and ask the questions, because one, it's on an official record, and two, people with disabilities are right in front of them. It's not a maybe there's somebody in the community. It's we're here and we want you to tell us how you're going to serve us. You know, we have these needs. Same thing goes at the state level, and that. And then working with your local disability, again, the Centers for Independent Living and your other disability-led organizations, you can get the stories. Every community has someone that's had an individual emergency of a flood or a house fire, to you know, national level type mass disaster type things that have occurred in communities, and that, and people have stories, and being able to tell stories and show the pictures and get that to the media, because they will jump on that story, which helps not only advocate to get the right information out, but it also keeps the pressure on the elected officials who are obligated to put the funding in place, and it puts the pressure on the agencies to do the job they're supposed to already be doing, because they already have the funds and the laws that are required. But sometimes it is also just reminding that there are laws, that these are not optional, they're civil rights, and that, you know, and that's what needs to happen. But really just getting people with disabilities in front of the people and in the conversation is probably going to be your best asset in moving things forward.
Thank you both for bringing out just really interesting qualities of persons. Passion is a beautiful characteristic. So I have an interesting question that was in the chat for Dan, and it's about a communication tool that is Viochi, and it may not be pronounced that way. That is Sarah Fisher's pronunciation. So I see that there is a link to it in the chat too, but how do you like it? Why was it chosen?
Viochi is a kind of a chat. It's an emergency planner or emergency response kind of chat system. And it was chosen by the University of Virginia Health System. I think it's very standard everywhere. It's just a great way. Before Viochi, we'd all have to call in at 5 o'clock in the morning or 4 o'clock in the morning to get the information, and then we would get regular updates. And now it's all live information. It's all chatted. You can create groups, hear your responders, hear your people that look for the equipment and things like that. So people could be put in different groups. I have no idea how much it costs because it's out of our hands, but it certainly has helped with the communication process, and you can broaden it as well. Before, there was only a select group that could be part of that they could fit into the room, and now it's a virtual room and a lot of people. So the communication tool, VHA, yeah, very, very beneficial.
Well, wonderful. Thank you. Well, I hope those are the rest of our questions. Anyone else out Out there in our audience, anyone want to throw a last one in? Because otherwise we're looking at rounding things out.
There was one more question. Why Viochi instead of a Slack or Discord channel or something like that?
Yeah, a good question. I know when we use Slack on the library side, and that's also a chat. I'm sure it has something, it's probably a more secure system. And since the VOCHA is used within the health system, I'm sure that's why. It probably has standards, higher standards in securing information than Slack.
Yeah, it does meet the HIPAA requirements because of disability related, and also for secure filings when FEMA posts some things that go out across, or CMS does with regard to filling out forms and things like that. It keeps it within the new government standards for security.
Okay, this is great.
April, how do you feel?
Oh, this is great. Yeah, thank you all so much. You know, Sandy, Beatrice, Dan, thank you so much for doing this webinar for us. It's so, really informative. And we have a resource page that we put together. I'm going to put the link to that in the chat. It's on the class page.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.